So I'm going to talk about pulmonary tuberculosis. It is commonly abbreviated as TB, so I may refer to it as that. It is a bacterial lung disease, and it kind of has the same effects as pneumonia. It is caused by the bacterium Mycobacterium tuberculosis, and it is an airborne disease, so it is transmitted through the air when somebody with the disease coughs or sneezes. So TB, it can be primary or secondary, and primary tuberculosis is usually 99% of the time asymptomatic. It usually involves the middle and lower lung area with lesions in the lung parenchyma. The lesions quickly spread to the bronchopulmonary lymph nodes where they gain access to the bloodstream. This predisposes the person to the subsequent development of chronic pulmonary and extrapulmonary TB in the future. So, secondary TB develops as a result of reinfection by the tubercle bacillus and is the most common clinical form. Reactivated TB usually causes abnormalities in the upper lobes or one or both lungs. In the U.S., secondary TB development is almost always the result of reinfection that occurs when the primary lesions become active as a result of debilitation or lowered resistance. And after a while, it may disseminate to involve lymph nodes or other organs. So the causative agent is the tubercle bacillus, but casual or brief contact with the just a few bacilli will not result in transmission of the disease because it's not enough. But prolonged exposure in like an enclosed space will. There's genetic factors determining susceptibility and resistance to the infection, but it's not proven. So the prognosis is good if you have proper treatment and a healthy diet. However, though, TB develops drug-resistant strains which make the disease harder to treat, and the onset and progression depend on the response of the patient. Lung damage with fibrosis can occur if not controlled. TB can also break down bones and vertebrae, causing sufferers to become humpbacked. A rare form called lupus vulgaris attacks and disfigures the soft tissues of the face. TB can also attack the brain as a deadly form of meningitis. People infected with HIV have a higher incidence of TB in parts of the body other than the lungs. So some of the signs and symptoms associated with TB. So if it is latent, then you won't have any signs or symptoms, you won't feel sick, and you can't spread the disease to other people. You'll still have a positive skin test, and then you may develop active TB if preventative measures are not taken or if your immune system decreases. If you have active TB, then you will have a productive cough and general body symptoms like fatigue, weight loss, fever, chills, and night sweats. So for confirming the diagnosis of TB, there's diagnostic measures, a history, physical examination, a TB skin test, which I'm about to talk more about, a chest radiograph, and a microscopic examination and culture of the sputum. So what your sputum is what you cough up. So the TB skin test, so the way that works is they inject a bacillus into you, and it's determined by how your immune system responds to it. So the skin and other tissues become sensitized to the protein part of the tubercle bacilli. A positive reaction causes swelling and hardness at the site of injection, which indicates presence of a TB infection. So for management for the patient with TB, rest, fresh air, sunlight, good nutrition, and exercise will definitely help the patient recover from TB. Medication is available, but like I said, there is that drug resistance associated with TB, so it definitely makes treating TB a lot harder. The anti-TB must be taken in compliance with the dosage and length of time is important in reducing the drug resistance forms of the bacteria. So for physical therapy and implications for the PTA, there is not treatment in physical therapy for TB patients, but the PT and PTA definitely need to know what risk is involved with TB so that they can use appropriate PPEs whenever they're treating patients. The most the PTA will ever really be asked to do concerning the TB is they may have to help a patient and instruct them on how to perform a strong cough.